Welcome to our third episode of Arugyam Katta. Today we have with us Dr. Nitin Deshpande from Ramakrishna Netralaya, Thane. Dr. Nitin Deshpande is a second generation eye surgeon and they have branches in Mulund. They are starting in Chembur. I believe you had something in Airolio, New Bombay also.
Yeah, Vashi and seafood also.
Washi and seafood.
Yeah.
We have 4 branches or 5 branches now.
Yeah.
Yeah. So Dr. Nitin Deshpande is the director of Sri Ramakrishna Netralaya and manages all the 5 centers together. Today we'll be talking about glaucoma as in principle, because of late there are a lot of patients who have lost vision because of glaucoma or unawareness of glaucoma.
Yes.
So Dr. Nitin Deshpande, can you explain to the viewers what is glaucoma?
So glaucoma is a very commonly found disease in the society, which is eye disease, and the incidence is almost 2%. That if you take 100 people in a room, almost 2 people out of those will have some form of glaucoma. So that is a very commonly present disease. Now, what this disease is, your eyeball is made up of, say, eyeball has a retina or a light sensitive layer at the back of your eye, which has cells called ganglion cells. And these, whatever your light, whatever the impressions are converted into electric signals, and these cells transmit it to the small fibrils called nerve fibers. And these fibers form a nerve, millions of these fibers form a nerve, which carries that information back to your brain. Now, in glaucoma, because of genetic reasons or any other reason where there is a raised eye pressure, these cells start dying, which reflects as a part of your nerve is lost, which is when an ophthalmologist checks your eye, he realizes that there is a damage to the nerve because of either raised eye pressure or reduced blood circulation to the nerve. So that is what is glaucoma. Now, glaucoma, it causes loss of vision. Like if the lower part of your nerve is lost, you will lose peripheral vision in the upper part. So the relation is reverse.
Oh, mirror image, like.
And in glaucoma especially, a person starts losing his peripheral vision. Like my hands are in a peripheral vision and my face is in the center. So, you start losing vision in the periphery, and gradually as the disease advances, this comes to the center.
Okay.
When it comes to the center, a person realizes that there is something wrong. If it is here, because your other eye is also compensating, you don't really realize that there is a problem. So unfortunately, glaucoma in large percentage of people is detected very late. Almost 50% of the patients would come to a doctor when they would have completely lost one eye. So that is a severe vision loss.
What are the symptoms? You start losing vision by periphery and come at the center. Any other visions?
Yeah. Unfortunately, as I said, when you lose periphery, you don't realize it at the initial time. So largely glaucomas are asymptomatic, or it's called a sneak thief of sight, because person doesn't realize he has a problem. So largely most of the glaucomas are asymptomatic. And if it starts in one eye, when your other eye is compensating, you will realize it only at a very later stage. So annual examination is extremely important. You have to go to your ophthalmologist every year, because detecting glaucoma is very, very important at an early stage. If we detect it early, we can prevent a severe vision loss. So largely asymptomatic disease. There are 1 or 2 subtypes of glaucoma, like angle closure, where there is a sudden rise in the pressure, person starts getting vomiting, pain. So these are very rare, few form of glaucomas which are symptomatic. Otherwise, largely person doesn't realize.
I see. Are there any types of glaucoma, or there is one type of glaucoma?
So there are many types of glaucoma. It depends on the reason why glaucoma is occurring. Now, the most common, the genetic form that is transmitted from in family. It is the most common is open angle and angle closure. Now, again, this is anatomical.
No, can you explain angle open, angle closure? Is good for you, but I don't understand.
So that is the anatomical classification, where your fluid is forming in the backside of your eye.
Okay.
It flows in front. It flows in front of the front part of your eye, and then gets absorbed into the blood vessels. Now, if your front part of the eye where it goes out of the eye is narrow, it is called as narrow angle. If it is open, we call it open angle. Now this is very technical, and we do it, we know it because we see it. We know where to see. So a common man won't know what is open angle, what is angle closure. So that is the most common genetic form of glaucoma. Now, other ways, like few people keep putting steroids without telling their doctor. Like doctor would have told them you put it for a week, they keep putting the drops. Now, steroids can cause rise in the eye pressure. May it be in the drop form or oral form. Or if there is any injury to the eye, the eye pressure may not rise immediately, but it might rise after few months, and you don't realize that you have a raised eye pressure. So it is called as angle recession glaucoma, which is because of the blunt trauma, like your ball injury.
Mhm.
Uh, then there are other glaucomas like neovascular glaucomas, like in diabetes, there is a blood loss of blood circulation to your back part of your eye called retina. Now, this causes abnormal vessels to grow in the eye and block the area through which your fluid is going out of your eye. Now, this neovascular glaucoma can also cause raised eye pressure and damage to the nerve. So there are many types. I mean, even newborn kids can have glaucoma. They are called as congenital glaucomas. Now, if you feel your newborn baby's eyes are very big, it is not a sign of beauty, but it could be actually a glaucoma. So you have to go and show to your ophthalmologist.
Ophthalmologist on urgent basis.
Yeah, so congenital glaucomas are very common. So I mean, there are many types, and glaucoma affects all age groups. So
I believe that means genetics plays an important role in glaucoma.
important because there are many genes already isolated which play an important part in glaucoma. Like TIGR is one of them. Now, unfortunately, we don't have a means to treat the genes to alter the course of glaucoma, unfortunately, at this point. But there is a lot of genetic research going on in this direction.
Mhm.
And in near future, I'm sure we'll be successful in treating glaucoma with genetic therapy, or
I
at
see.
least preventing or knowing if some person is going to develop in future.
So I believe early detection is the key to the whole thing.
Absolutely, because our focus is on early detection. Because if detected early with modern drops or surgeries, we can prevent a severe vision loss. The
Mhm.
whole idea is to make sure that a person maintains a good quality of vision and a good quality of life
Right.
so that his day-to-day activities are not affected. And that is possible only if we are able to detect it early.
Does the loss of vision which has occurred, is it reversible or irreversible? It's gone, or is it possible to regain part of it?
So unfortunately, glaucoma is a disease of the nerve, and the nerve fibers, those are lost, cannot be recovered. But early detection and a timely treatment can prevent a severe loss, and we can try to at least slow down the process so that person doesn't lose his vision and doesn't make him incapable.
That's Are there any advancements in glaucoma management?
So, glaucoma is a very rapidly advancing branch of ophthalmology.
Mhm.
Uh, Over last 20-25 years, we have seen a sea change. And if you see, consider the modern drops, which can control eye pressures better. We
Mhm.
have conventional surgeries like trabeculectomy or Ahmed valve surgeries where you need stitches. Now, the newer microincision glaucoma surgeries don't require any additional cuts or stitches, but it is good only for the early disease, of course.
Okay.
But now there are a lot of new lasers like selective laser trabeculoplasty. Now these lasers we can treat the patient in the early stage of a disease and reduce number of drops they are using, because a lot of drops cause irritation, dryness, side effects. So with the microincision surgeries, lasers, we are able to reduce load of drops and also at the same time making sure that disease is better controlled.
Mhm. Now, does the diet has to play any role in glaucoma? Like where non-vegetarians have more percent or lesser percent and veg, I mean, is there anything to do with the diet? I'm
So
not talking
diet,
malnutrition. I'm talking about a healthy diet, like all middle
yeah, yeah.
class. I'm talking about that kind of class. We'll come to malnutrition later.
So there is election time, so we must thank our PM to take out 200, 300 millions out of
Correct,
poverty.
correct.
So Indians are well fed now, luckily. There is no evidence of any veg or non-veg food causing any effect on the course of glaucoma, neither causing and also not causing glaucoma. But a good healthy diet is always welcome.
Mhm.
But there is no direct correlation that has been noted by any publication till date. So I would suggest a good healthy diet is sufficient to
Okay.
prevent.
Any advice to your patients about जनरल लाईफस्टाईल आय मीन आय डोंट वॉन्ट की चांगलं खा व्यायाम करा हे करा ते सगळे डॉक्टर सांगतात आणि कोणताच पेशंट ऐकत नाही म्हणून तर डॉक्टर आहेत आणि म्हणून तर डॉक्टरांकडे जावं लागतं पण बिसाइड्स दॅट एनी स्पेसिफिक थिंग्स फॉर गुड ऑफ्थॅल्मिक हेल्थ डू यू हॅव
Uh,
एनी ॲडवाइस फॉर जनरल पीपल
So annual eye checkup is absolutely mandatory. Many eye diseases, if they are picked up early, we can prevent a lot of vision loss. And many eye diseases are asymptomatic. You don't realize you have a problem. Like somebody ignoring a cataract and delaying cataract can actually cause a bad severe vision loss due to secondary glaucoma formation. Or another example I gave was we are completely glued to our screens since COVID, so many people have developed dryness. So if they don't go to a doctor and if they don't, they are asymptomatic, then they will just miss out on their dryness, and you know it only when it gets worse. So then again, kids which are totally glued to screens now and computer games, the myopia, that is the minus powered glasses in kids, are increasing. There is an epidemic of myopia in India where myopia has gone up by 10 times. So if you know that that kid has developed myopia, because if you kids are not going to tell that they have a vision problem.
what is myopia I mean if you can tell in a simple language
So if your eyeball becomes longer than normal, you need
okay
minus powered or concave glasses to focus the light on the retina. So minus powered glasses, so eyeball is longer than normal. That is what is myopia. Now it will just, the eyeball goes on elongating if you don't take care. You know, now we have a lot of technologies like better drops, then newer type of spectacles to control this worsening or progression of myopia. At the same time, lifestyle modification is very, very important. That kids need to spend some time outdoors in sunlight. So all these basic hygiene points, I think parents will have to understand and inculcate. I mean, they need to follow those guidelines and help their kids to prevent a very high myopia. Because if the myopia becomes very high, there are chances of retinal complications in these kids. So preschool screening is mandatory. Like all kids should get their eyes checked before they take a school admission. Then annual checkup is mandatory for everyone, for adults as well as kids. So all these things are basic preventive things that one can do to prevent any advanced form of any eye disease.
on your card I see glaucoma and refractive surgeon. Now we have discussed enough on glaucoma, of course, not fully, but what is refractive surgeon?
So refractive, like be it cataract surgery or be it somebody wearing glasses and who don't want to wear glasses, we can correct their numbers. Now that is what is called as refractive, that we can
Okay.
get rid of glasses. So with cataract patients, we have better technologies like robotic surgeries. Now we launched a LI system first in India recently, which is a very advanced form of this robotic cataract surgery. In few seconds, all the cuts are done so accurately that the safety goes to a different level now. And we use very advanced lenses like trifocal lenses, so person doesn't have to be dependent on glasses neither for a distant work, neither for a reading work. And in people, younger people who don't want to wear glasses, we have newer treatments like contour LASIK, or there is a beautiful new surgery called Atos from the Atos machine from Schwind, which is a flapless LASIK. It is such a small cut LASIK that there is no flap in the eye, and recovery is super fast. I mean, we joke that you can go boxing after 2 days. You know? So
Mm-hmm.
recovery is that fast. Safety margins have gone up, and at the same time, we have means to reduce dependence on glasses. That is what is refractive.
Nice. So thank you for being with us today. And any last minute message to the viewers you can tell us?
Yeah. So annual checkup is again what I want to stress again and
Annual
again.
checkup, lesser screen
Yes.
time. I think
Yes.
these are mantras of tomorrow.
Yes. And at the same time, I want to thank you for your guidance for past 2 decades. We did our first ISO with you and then NABH. And through this journey, we have enriched ourselves and also we were able to pass on a better eye treatment to our patients. So thanks from the bottom of my heart.
Thank you very much from Arogyam Katta.
Yes.
We will meet you again with some other topic because I know eye has complicated. I mean, a lot of topics within eye. So next time we'll touch some other like cataract or
Yes.
a elderly eye loss. These are the two things. But that time
So,
we'll have in Marathi.
and we are coming to your backyard in Chembur very soon. So next
Yeah.
eye katta we will shoot from our Chembur center.
Yes. Welcome. Thank you.
Thank you. Thank you.
Thank you. Thank you.